Yes, despite these ECGs are not clear perfectly, but it is have a teaching purpose. Look, because it is for the same patient with dilated heart or heart failure. This is the first ECG, left axis deviation here, and prominent B wave sinus, but low R wave progression, inverted B wave in AVL, and the premature ventricular beat seen here with interventricular conduction delay, widening of QRS complex, and low R wave progression. Look carefully, this is premature ventricular beat. Yes. And the second ECG for the same patient, this also still left axis deviation and sinus rhythm. This is lead 1, and this is AVF with the premature ventricular beat here. Please concentrate. And slow progression of R wave, because the dilated heart and more prominent R wave in V6. If the R wave is prominent in V6 more than V5, that is the heart is dilated and deviated to the lateral side. Here the same patient came with tachycardia. This is wide complex tachycardia, but it is not hugely wide complex, is relative widening, but there is a change of QRS complex in morphology also with tachycardia. Here the differential diagnosis, it is a supraventricular tachycardia with fixed bundle branch, left bundle branch block. That is apparent conduction. And the most important thing, it is the ventricular tachycardia that caused by bundle branch reentrant VTAC, because this patient was not responding to usual maneuver such as vagal stimulation or drugs used in treatment of supraventricular tachycardia. Therefore, the diagnosis of bundle branch block reentrant VTAC is the possible diagnosis, and the differential diagnosis should be done by electrophysiological study. The bundle branch block reentrant VTAC is hardly to differentiate from other types of VTACs, and from the supraventricular tachycardia with abnormal bundle branch block, because it is not change in axis and QRS complex similar to that VTAC, to other VTACs, and because it's initiated near the conduction system, the QRS complex remains small or less wider than the intramyocardium ventricular tachycardia, but it is not responding to usual medication that used in the treatment of supraventricular tachycardia. And the effective treatment for this, for the bundle branch reentrant VTAC, is radiofrequency ablation. Yes, we understand, as you know, that the dilated cardiomyopathy or ischemic cardiomyopathy, different types of and different morphologies of arrhythmias can be initiated. Therefore, radiofrequency ablation is effective in the treatment of bundle branch block reentrant VTAC, but it's not enough to control all abnormal rhythms that can be initiated from the scar or from other side. But keep in your mind this fact as written in textbook: in patient with abnormal QRS complex during sinus rhythm, such this patient, This is abnormal ECG related to abnormalities of conductive system. When they came with tachycardia, the bundle branch block reentrant VTAC, it's one of the differential diagnoses. In addition, the presence of premature ventricular beat, it's a good hint that the tachycardia, this bundle branch block reentrant tachycardia, it is initiated by re-entry mechanism. Yes, thank you for your kind watching and listening.